while many therapies that we have are good for symptoms, not as many are good for survival, for improving mortality. The biggest one, and it's the one we always come back to, is COPD, is quitting smoking. And people have to realize that even if they've been smoking for decades, that there is a benefit to quitting. As soon as you get off that slippery slope that smoking represents with COPD, where you're losing lung function rapidly over time, if you manage to quit smoking, you get off the slippery slope and you actually sort of level out in terms of your lung function. And that's very, very good for the long-term benefit of survival. It also helps survival from the standpoint of heart disease and cancer risk and all those other things as well. So that's number one with regard to improving survival.
One treatment is actually been shown to improve survival. That treatment is supplemental oxygen. Everybody with COPD should be assessed for the need for supplemental oxygen. If the oxygen level goes down too low, then the result is an increase in blood pressure inside the lungs. We call that pulmonary hypertension and a strain on the heart, and that leads to early death. All patients with COPD should be assessed for the need of oxygen when they're walking around and when they're sleeping, and supplemental oxygen for those that need it will actually prolong life.
With respect to the surgical options for COPD, lung volume reduction surgery has been shown to improve survival, but only in a very select subset of COPD patients characterized by upper lobe predominant emphysema and a low exercise capacity. For other patients who don't meet those criteria, lung volume reduction surgery was either associated with no improvement in survival or even a detrimental effect with enhanced perioperative mortality. The final surgical option is lung transplantation, and it's still problematic as to whether those patients actually improve survival with that therapy as opposed to without.
Rehabilitation probably also improves survival, although to do a survival study in rehab is probably a practical impossibility. But the general consensus is not only are people way better off if they undergo pulmonary rehabilitation, but it's likely that there's also a survival benefit.
With respect to pharmacologic therapy, the most compelling evidence relates to the combination of a long-acting beta agonist and an inhaled corticosteroid. There are two trials that have suggested a survival advantage, one trial not quite reaching statistical significance, and the other showing a modest survival advantage.